Much.
10 seconds of silence.
Thank you. Oh, yeah.
Thank you.
And away we go.
Okay, so I'll get right into it. So
Yeah.
we just go home and I can smoke my weed.
I smoke weed
Who
now.
said that?
Not
You
that.
do?
Yes,
Good for
yes.
you,
Didn't I?
girl.
Yes.
Oh my God, we need to talk.
Yes, and I actually inhale. It took a year for me to learn how to inhale. They're like, yes,
Good,
okay.
good. Oh, we need to record.
Okay.
So the conversations are not biographical. It's
Okay.
not about you from birth, to now, but it's about particular situations that are stuck in your mind in your relationship with healthcare providers.
Okay.
And how you've navigated them and how you've seen them navigate them. Particular situations that could have started a little bit choppy, and then thanks to you or thanks to the other person, kind of got a little bit better.
Yes, absolutely.
So let's start with when I say this, are there any stories, most recent stories, that come to mind that you go, oh, that started kind of weird and then we got into a groove, and what happened?
I think most recent was my adult doctor that I actually transitioned to out of pediatric care. She was my mom's doctor, and just being in pediatric care, it's very much your healthcare provider and your parent talking to each other, and you're in the audience. So I didn't know as an adult how to advocate for myself, how to say if something wasn't going to work. And so when I lost my mom and my father to HIV-related illnesses, I kind of had a breakdown and stopped seeing my healthcare providers. And then when I went back in, it felt like there was a wall. And my doctor actually said, talk to me. Tell me if something's not going to work. I'm not telling you what to do. This is an open-ended conversation. We can communicate. And I was so grateful for that. And that really started this great relationship that I have with her. And I'm so happy I didn't switch. I feel like I would have fell out of the sector. But now I text her because I'm not a phone person. We text. We're really able to openly talk about things, talk about dating, talk about certain medications. I'm able to ask her when the once a month needle is coming out, and it's just a really great relationship. And it's also some kind of sweetness that she did know my mother, because it does feel that sense of family, and we just have a really great relationship, and she really works on my pace and doesn't judge me if things are not going to work, and understands that this is somebody who's been living with HIV her entire life. Sometimes things get tricky or tough, and she doesn't judge me and say, just take the one pill once a day. And she doesn't judge me and say, don't have sex with this person. She's just a true provider for me, and I'm so grateful to have her.
Have you had other kinds of experience?
I have had, so when I was diagnosed in Ottawa, it was just back and forth with the doctors. You don't really understand what's even going on. And then as a child, you're just told it's a big secret. And you're used to my mom, and my mom is an African woman, so it's just, Maluba will do it. I'll make sure she's going to do it. And so I didn't feel like I had a voice and I could say if something was uncomfortable. I didn't feel like I could ask questions. I couldn't bring up sex because my mom said she's only going to have sex when she's married. And I was like, it was difficult because your parents are in the room for everything. And it felt like my doctor and my parent were talking to each other, but I was just an audience member and I didn't know how to find my voice within that. So when things were going awry and when I became a teenager and stopped taking my meds, when I would go to sleepovers, I couldn't even express what I was feeling. And then it's just been difficult, finding a pharmacist that you feel like is going to understand, is going to keep your information. I've really been scared to go to places like Shoppers Drug Mart because those are big industries and it just feels like they easily call people up and say your HIV meds are here. And so
How come you brought up pharmacists? Did something happened, or you
I
just thought of it as an example?
For me, it was, I wasn't really comfortable with my pharmacist from the beginning, that I did have. I just felt like, when I first had to get drug coverage, they didn't really help me out or explain that thing to me. I didn't really feel like accommodations. And then when I finally found my pharmacist now that is in a different town, they'll do Bristol packets for me. They call me and explain what to take and if I should take them the food. And I just feel like that's been like saving, and I don't feel like a lot of people take the time. We're in a rushed world these days, and it's been difficult. And I think that with HIV, and I'm young, I'm 26, but there's just so many things that I need. So it's, doctor, pharmacist, social worker, and all these things. And it's been difficult to find people that have that niche and that can blend with my personality. I feel like there's a lot of healthcare providers out there that think it's one size fits all.
Tell me about an experience. I think I understand what you mean.
Yes.
About experiencing, and you mean you being a young African-American woman.
Yes.
Not only HIV is like one of your components, right? So can you think of an experience where
I am completely traumatized of hospitals and of emergency rooms. I just think that, just recently I was in the emergency room and they asked me where I was from, and I just thought it was conversation. And as like an immigrant, you don't really say like I've been in Canada, so I just said Zambia. And then the next day I was in isolation because they assumed I had TB. And so it was just it feels like they wouldn't read my chart. They just wanted me to keep on having to tell them how I got HIV, how I found out about it, all this stuff. And it feels so grueling. And it feels like, and then they would come in, and if something's wrong with your chart, be like, why can't you do this? I've dealt with people that are living with HIV before, and they can do this. And so just talking down at me. And I dealt with a physiotherapist when I was at the hospital, and she kept on telling me every single moment, you're so young, why are your legs weak, you're so young. And then when I tripped over something and my eyes went cross-eyed, she was like, you're kind of looking like a little dumb right now. And it just felt, yes. And
So did she use the word dumb?
She used the word dumb, and I didn't even know how to express, and I felt so vulnerable. And I felt like, I remember I said to her one time, I know my age. You don't need to keep on telling me. And
What did she say?
They just laughed it off, like somebody that's embarrassed. It was hurtful. And so I am very much like, people that I know I will go see for things, but I never want to go to a walk-in clinic or an emergency room and have to deal with that. Just finding a dentist took me about what feels like 2 years to find a dentist that would.
What happened? I mean, you had to visit several of them.
Yes, I visited one, and it wasn't the dentist that I saw, but the hygienist kind of, after when it was said, kind of just took her tools out of my mouth and acted very uncomfortable. That was when I was much younger. Then there was another clinic that I went to that refused my certain insurance and asked, why are you on ODSP? And so it was the receptionist, and I was like, in the reception, you want to ask me why? And then she was just like, oh, get your parents too. And I said, my parents aren't around. And so it felt very nosy. And then another time I went and the dentist said, you need to come in more often because HIV can ruin your mouth. And it felt like, oh, because you have HIV, like your mouth this. And it just felt very stigmatizing, and it was uncomfortable. And I think there probably were other factors. There's always, of course, racism and sexism, but then finally finding a dentist that it's normal and we just go and do what we have to do. is a blessing, which when I talk to my peers that are in different situations, they don't talk about finding healthcare providers that can assist you as a blessing. And it's crazy that I think of it that way.
And when you say peers, it's other folks living with HIV, but we could be talking about white gay men, for example.
Yes, white gay men, but then also peers that folks that are not living with HIV, that go see a doctor every 6 months and don't really know their doctor's name or have to tell them that much information. And they don't think of, and for them, it's just, that's their job. So why would I figure out and be so thankful for them? And I think at my last HIV specialist appointment, I hugged my doctor because I just felt like I got so much better, and she's just been so understanding. And I was just like, oh yeah, thank you. And it was just a natural hug. And I just felt like it was, people don't regularly do that, but I'm so appreciative for who I have in my life, and it's a journey.
I've heard this experience before and somewhat lived in that we run the risk of when we go to see a healthcare specialist of any kind, is that they attribute everything that is going on to HIV when it might be associated but not the main thing.
Yes.
So I remember the particular case of African woman who's a newcomer having in a city in Canada having an accident, and the doctor changing completely the story when she needed to ask for insurance, saying no, the problem was not the accident.
Oh.
The problem is HIV, and
Yeah.
no, it was an accident. So radical. So she had to go back to an advocate. I can't remember her main physician to say what's going on with this. These people don't want to pay my insurance. I didn't collide with HIV.
Exactly.
Right?
Yes. It's so true. I'm in 2017. I started feeling very weak and stuff like that. But I said my last, blood results.
Sorry, there's that noise.
Oh, I should have thought of it. And my last results were undetectable, so I went to the walk-in and said, why am I feeling so weak? And of course, it must be the HIV, it must be this. I said, is there an antibiotic? No, I think it's your HIV, it's affecting your bloodstream. And I told him my last results were undetectable, and ever since then, I haven't missed, in the last 2 months, I hadn't missed a dose. So I was like, I don't think it would be that. Is there something else we can test for? Kind of just shut me down. Didn't do blood results or anything. Saw my HIV specialist, explained that, and then I got a call the next day or a few days later on and said, you're still undetectable, but your iron went down. They referred me to a hematologist. All of 2017, I was getting iron transfusions every 2 weeks. It was first weekly, then every 2 weeks. I had to go to the hospital, stay there for 4 hours. My energy just shot up. And I remember when I saw the hematologist for the first time, she took my blood and they said, we can't let you leave. They said, you must have a very strong heart because we don't know how you're standing right now. And so it was just like this walk-in doctor was so convinced that it was the HIV that if he had sent me to Life Labs to get this drawn, I would have known. So that whole day when I just had that morning appointment with her, I had to cancel everything else because she sent me straight to the emergency and I had to get a blood transfusion. There's so many things like that. I work in the healthcare, I work in the community sector, and I'm dealing with young women who are thinking about having kids. And I just had a client who is pregnant, and she's really going through being a woman living with HIV, pregnant. Some stuff don't relate to you. Some people want to keep on asking questions. Some people almost want to judge you and say, why are you having a child? And this is people who are supposed to work in the healthcare sector. It's very hurtful. My sister just had a baby in November, and when the nurses, I think she said something about her mom passing away of HIV, and the nurses said HIV because they just heard that one part and kind of like jumped up for my sister. And she said, whether or not I have it, you're a nurse. I would hope you're taking safety precautions no matter what. And it was disappointing for my sister because she was just ready to fight while this baby's halfway out of her. But it's that's in the healthcare sector. And unfortunately, stigma will be a huge part of it. But then another part is that we're just in a speedy world. And for me, this is a virus that I've been living with for all my life, for the last 26 years. And, maybe I'll see a cure in my lifetime, but, for the rest of my life. And so I want to have that relationship where we can have open conversations, and I want to not feel judged. And it's hard to be a girl growing up with HIV, and then you don't know how to explain to your doctor, oh, I think I should get a pap smear now because I've had sex, and you just feel like you're going to be judged. And I just feel like, talking to my doctor and then being like, oh, okay, like it wasn't a big deal. Maybe I had some inner stigma for myself that felt like I shouldn't be having sex, and I can't explain that to healthcare providers.
So that's one of the things that you've been developing. I mean, even from the time that I met you the first time. So what are the things you feel that are more, that empower is a big word, but that you feel, okay, from the time that your parents stopped, that you stopped being, what was the way you used this? You stopped being the audience between your parents and the doctors. It's been a long time now. What tools have you developed that you say, oh my God, I have to use this often? Yes.
I think it's... Ooh, what tools have I developed? I've never been asked that or thought about that. That you go with the flow and learn new things all the time. But I think...
Because my example, while you think about it,
yes,
is now I'm 56, and I can be very acquiescent, but I also know when to be assertive and say, I understand what you're telling me. Mm-hmm. No, this is what I would like to do, or I don't agree with that. But that comes from having almost rehearsed it.
Yes.
A long time, and certainly 20 years ago, I never said that.
Yes.
Well, I'm lying. That's my problem, right? But other people have had, even the folks that we've interviewed today, at first they've been like, okay, and then they've said, no, I need to push back, or they found ways. So what are these tools, these ways that you...
Oh, absolutely. So assertive is definitely one thing, saying that I completely understand, I've heard you, but now hear me. I think asking more questions. One thing my pharmacist in the clinic knows, if we're going to change Maluba's drugs, you better have a sample of those drugs, because I need to see what I'm going to be putting in my mouth. That was a little joke. And so she's like, so I'm like, you need to show me, so that they understand that. I also understand asking for help. Now that's something I'm still working on. I will take a while to ask for help sometimes, but definitely being assertive, conversing with my doctor, and letting people know what works for me, not just going with the flow and saying, well, I'll do this and I'll do that. I make a lot of lists before going to my appointments so that I can just remember stuff, because sometimes you can feel rushed out. They're doing clinic visits, so I like to have lists of, these are my concerns, this is what's going on, this and that.
And some of them hate the list. I've been told to put away my list.
Really?
Oh, yeah.
Oh, they can't tell me that. Oh, no, absolutely not.
Because a memory, and I need to, like,
yes,
a person like you, and so I need, like, okay.
Yes, oh, absolutely not. And that's what I have, a bad memory. So, and my doctor knows it. So we definitely need the list. It's on the notes apps. And if anything, I'll text it. I'll PDF it to somebody.
Tell me a bit more about asking for help.
Even, when you start working and kind of get like halfway off ODSP and figuring stuff out, I don't know why I try to handle it all by myself, even though there are stuff like social worker, your doctor can write a letter for certain stuff. I don't know why I try to take it all on. And so it does take a while if I'm having problems with my medication or side effects. I just kind of want to try to suck it up or handle it myself or tough it out. And maybe in my mind, it's just, doctor has so many other dire needs. There's probably people that are worse off than you. Don't bother them. or I don't know if it's a sense of begging, and I don't know if that's in my pride or just my young self not wanting to admit that, but I'm getting better, so slowly but surely, and I also have to learn. And my doctor actually told me this. She said it took me nearly 30 years to start saying no. Do not take that long. And she said you can even say no to me. And that was a huge thing because I didn't think I could say no to her. I didn't think I could say,
Why?
Doctor knows best. Doctor knows my body best, which is not true. I actually know my body best. I wake up in it every day. And I just thought that she's given me the best solution, so I just have to listen to her and I just have to suck it up. And she told me, no, that's definitely not the case. You can say no, and you can say what's going to work for you. And you can even tell me you don't know. And that's where we need to work together to figure out what's going to work and trial and error. Another thing that I have learned, and I call it my, before people learn my name is Maluba and I'm from somewhere, I just kind of call up somewhere and use my white voice and just kind of act like a 4-year-old soccer mom. I need this, I need that to be done. And they take me seriously until I say Maluba. Then they kind of know and that's kind of gives me my confidence voice. And that's when I feel.
But you have to, this is interesting because you have to pass, because this is one of the reasons I try to speak very good English, because I knew that would be a defense mechanism.
Yes.
Right? And people, even Latinos, say to me, where did you learn your Spanish? And I'm like, no, it's my first language. It's my fiber.
Yeah.
But I also, the other thing you were pointing out reminds me, I always felt that I owed people something. So I was saying yes and yes and yes, and I owed because they were giving me free service. It was a sense of entitlement that I have more of now, but I didn't have.
Yes, I didn't even think of it that way, but it is. They're giving me free service. They're not complaining. They're not, she's doing this out of the kindness of her heart. You forget that they get paid, and it's just, I have to go with it, and that I'm going to be a disappointing patient, or I'm going to be a bad patient. And that's the worst thing. You don't want to be a bad child. You don't want to be a bad employee. You don't want to be a bad patient or a trouble patient.
Because look at all we've done for you.
Yes, look at all we've done for you.
Head, at least in my head, it's always, look at all we've done for you.
Yes.
This is how you're going to pay me.
Yes. And somebody who's from Africa, obviously I know that some stuff in the third world countries are not as available. So when, you have this available, you just get to show a health card and you see a doctor and you get medications. You can't complain. You can't be troublesome. And so I don't complain until I fall over or fail at something. Then I get very embarrassed of everyone. And it's a shame. I never, in situations where I've had a bad family doctor or something like that, I've never wanted to complain or switch because I don't know who I'm worried is going to judge me or think I'm a troublemaker. And I don't know if that's the bane of HIV, that sometimes that's already seen as a bad thing, so we want to be completely good in other areas. But it's, yeah.
That. I mean, it happens to gay men, right? We're gay, so it's not really good.
Yes.
It's very liberated and all that, but so you gotta be a good gay man. So we do all the, and this is why a lot of gay men, and I'm just thinking about that, it's just one example.
Yeah.
Gay men would not talk to their physicians about their use of chems.
Yeah.
Because they need to be,
Yeah.
So you're not going to be discussing my use of meth with the physician,
Yeah.
because you're supposed to be a good HIV positive or gay man. So we live always with dissonant demands. Kind of,
yeah.
Damn if you do, damn if you don't, right?
Exactly. And it's like, I don't know, am I wanting to be applauded when I go in? Just, oh, we're still undetectable, CD4 is up. Like, or do I think that if my CD4 goes down, she's gonna beat me? I don't know what I'm thinking, but I don't want to fail. I don't want to disappoint her. And that's where you have to think that this is about you and your body and your health, and you kind of just have to ask for what you need. And if they can't provide it for you, look where you can find it, work with it. And I'm still learning my voice in the healthcare sector and how to ask for things and how to sometimes tell that I need things. And I'm still finding that footing, to be honest. There's still that little girl who was in the audience, and I think she'll forever be there because it's hard for us to get rid of childhood things, but I need to kind of just let it be and find that voice within and bring that out.
I can't. One last thing. I know you're working with a lot of young folks. What is your, I mean, obviously you take case by case, but what is your number one go-to advice? First thing that comes when someone is newly introduced to you, you're going to be working with this person or this person.
My go-to advice, I always ask them what they want to ask and anything, but I ask them, how is that person treating you? How do you feel as a person? How do you feel about your healthcare journey? But I always say, have conversations with your doctor and you decide what the relationship is. I have peers that just, me and my doctor, we don't get personal. We just kind of it likes to be in and out. And I personally get personal with my doctors. So it's always, you decide where that relationship is. You decide what that pace is. That is their job. And you can, I remember I said at a youth event, I said, you can get rid of your doctor. And I think another doctor mentioned that as well. And they're like, we can fire our doctors, like fire them from the system. And they were like, no, you can, not be with that doctor. You can always switch. And you have to decide. I decided to have conversations with my doctor and build that relationship. But if you don't think it's buildable, do what's best for you. I don't think you owe anything. And I'm very great at giving advice and I need to take my own advice, but you need to do what's best for you. I never would say you owe something to anybody. You have to do. And my number one goal is asking, are you happy where you're at? And if not, how can we get you there? How can we do that for you? And it's interesting because some people prefer to have clinic buddies. They want to go to the doctors with another person living with HIV. So they'll want their appointments back to back.
Not a patient advocate, but a clinic buddy.
Yes, clinic buddy. Yeah, that's actually what we do at ACDR. We do clinic buddies and medication buddies. So people that will actually call each other up and take medications together. But there's people that go to their clinic together and have like an 11 o'clock appointment, an 11:30 appointment, and kind of just they hype each other up and say, okay, so you're not going to back down when they say this. You're going to remember to say this. And it really just gives them the confidence to have a friend there. Especially sometimes the clinic can seem lonely. And and so it's really interesting to see that. And sometimes I'll go with people and just say, you need me there? I'll just, even though I don't go to your clinic, I'll just walk on in and just be a support for you. And once you're in your appointment, I'll be at McDonald's and you just meet me and we'll talk. And you need that convincing sometimes from friends and just to have, stand up for yourself and stand up for your health, because we are trying to make our life long, and I believe healthcare providers most are trying to do that as well, but their way is not always the right way for us. And that's, you have to live in your body every single day. So keep in mind for that. Thank you. Thank you. Awesome. The Maluba Show airs Fridays at 9 p.m.
So are you serious? You're going to have a Maluba show?
Yes, absolutely.
Because I've seen it on Facebook.
Oh, yes. It's the new hashtag. I'm just waiting for, Oprah's coming on June 14th, and I'm going to be in Niagara for the Youth Summit. I almost just quit on Adrian and said, I need to go meet Auntie Oprah. We need to get a deal.
So if you're absolutely sure you have a way of advertising, we have